Okay. So yeah, thanks for inviting me for this short talk. And I'm going to go through how to prepare for an interview. So I'll just tell you a bit about my journey. I won't take up too much time for this. I graduated from the University of Sheffield with my primary medical degree, and then went on to do foundation training in the East Midlands. And then I went to Yorkshire Deanery for the core surgical training, which was all in Leeds. I had a great time there. I then did a doctorate degree. I did a research project, and I got a DM from the University of Nottingham for that, where I carried out a randomized control trial on bowel cancer patients. And after that, I went and did higher surgical training in the East Midlands Deanery. And after completing that, I'm now a consultant at University Hospitals in Birmingham. So let's go on to preparing for the interview.
So Bhaiya,
are the slides okay?
It's I don't know if you're moving or not, because we had that issue with the Prof's slides. They were not moving, although Prof was moving them. So would you like to move a slide just to before we go, just to make sure that it is being presented?
I'm moving.
We can't see it. Can you put?
Let me try.
Now. Nope.
Yeah.
Oh, can you see it, Rafida? Oh yes, we can see it now.
Yeah, I can see my journey. Yeah.
Yes. Excellent. Okay. And now we're on preparing an interview. Thank you.
Good. Okay.
If you could just put them on slide view on presenter mode, I meant, sorry.
Yeah.
At the moment, it's
a bit small, basically.
I think. Yeah. Can you see now?
We can, Bhaiya, but if you put down on the full screen, the presenter mode on the PowerPoint, that just would be nicer for the people.
So yeah, I've done that. I'm not sure if it's gone back to you guys yet.
Okay, maybe there is a lag. Anyone can see?
No, not yet.
I still can see the short one.
Yeah, so I've put it on full screen on. Let me just see if there's anywhere else where we can.
The audience can't see either full screen.
Okay. So the alternative is just to make the slides bigger. How about that?
Yeah, I think, is that to our audiences, please mention in the group, is that okay? I think I can see it better. What about
I can
others?
see that too.
Prof, you are the one with the most experienced eyes.
Yeah, we're getting 2 thumbs up. Yeah.
Excellent.
Okay. All right, let's continue then. So I wasn't sure if this interview sort of tips. Well, I assumed that there was going to be a variety of background trainees. So I've tried to make the presentation as generic as possible. So the sort of 4 steps I would suggest is know about the job that they're advertising. And this may be your first NHS job, so it may be a foundation doctor job in acute medicine, and you in the long term may want to be a psychiatrist or a surgeon. But look at the details of that job and make sure you know that really well, and then figure out what they want, what they're looking for. Be mindful of that, and then know yourself, including your CV, and then prepare. So I would say, in terms of knowing the job, this may be really obvious, and so I apologize for stating the obvious, but this is either going to be a training post or a trust grade position. It's like you're either going to be going to a sort of national recruitment process or a local recruitment, so an interview at a hospital. Have a look at the job description, because that's normally is quite detailed, and have a look at the person specification as well, and match up which of those that you meet. So the pre-interview visit, it's not mandatory to go and visit a place before an interview. Often people are remotely doing an interview to a hospital they've never been to, and that's still okay. But if possible, make a pre-interview visit. It will give you an idea of the place, some of the other doctors that work there, what it is like. It'll give you a feel for the place. And you can, drop that in the interview, especially if they ask you questions, not least closing question actually at an interview, or it may be a question about, to tell us why you want this job. And if you can say you visited the hospital and you've spoken to the PAs, the specialist nurses, the secretaries, or you've actually taken an interest in the hospital, the post, the team. That really counts. What I would say is that it's not just a visit. Especially if you're going to meet the recruiting consultants, take it like an interview. So the typical sort of scenario is that you've emailed the recruiting consultant for a job, you send them your CV, told them you're interested in this post, you're applying, or you've just submitted your application, or you're in the process of. When they meet you in person, they're essentially getting a chance to get to figure out who you are, what you're about, what you're like. So be professional in terms of your attire, in terms of your conduct, in terms of how you speak to people, taking interest in the entire team. But be friendly. Just think about the other person's perspective. They're thinking, do I want to hire this guy or girl? Would I want them as a colleague, or would I want them as a junior? Do they seem like somebody that would be all right to get on with? Because essentially they're going to be your colleague for at least 6 months, 12 months, and they're going to have to work with you. So keep that in mind. But the pre-interview visit can be beneficial. So more about knowing the job. Okay, so we've talked about apologies. We've talked about the pre-interview visit. Let's go on to about the interview. So typically an interview is consisting of an icebreaker. So they'll say something like, tell me about yourself, or talk me through your CV. You've got to sort of be mindful, what are they asking? What are they really asking? This is an icebreaker. This is kind of an intro. I wouldn't aim to spend 20 minutes going through every detail of your CV. This is an icebreaker. This is to just get you talking, get you more comfortable with them. So prepare for that question though, because that's like an obvious question. The icebreakers are normally in that format, and so be able to succinctly tell about yourself in a few minutes. Focus on the job that you're doing. So if you're applying for an acute medicine trust grade SHO job, because that's the only one within driving distance of where you can be, but you've always wanted to be a surgeon, I probably would not elaborate on that so much. So tailor your answer to the situation. And then there'll be clinical questions, management questions, leadership questions, and then maybe a closing thing. That's sort of a typical makeup of a trust grade position. If this is a training post interview, there might be a more structured way with stations, a bit like an OSCE, with preset questions. So clinical questions, what are they really asking? When they're asking you clinical questions, what they want to know is, can you do the least that's required of you well and in a safe way? So generally, the questions are often about emergency scenarios. So if you're for example, surgical F1 or surgical SHO, they want to know that you can approach a patient, manage the ABCs, keep the patient alive until the management is being put in place and seniors are around. So often the questions are emergencies, and this leads right up to consultant level actually. So if I'm going for a consultant upper GI surgeon's post, I might expect a clinical question to be how you manage a Boerhaave syndrome, for example. So the training posts, on the other hand, they normally have banks of past questions. Past questions are often repeated, not always. Typically the makeup, let's just say you were applying for general surgery ST3, they will have probably a bank of past questions, and they would pick about half the questions in that interview diet from old and half from new ones that have been written. So certainly practicing past questions are beneficial, and you might be able to get past questions either from trainees the year above who have got their training number, and then there are some websites that also essentially what they will do is collect past questions, and then they will sell subscriptions to their website for that. So MediBuddy is a good one. That's the one I know about, and that's reasonably up to date. And other ways you can get banks of past questions is if you go on to interview courses. So interview courses can be a little bit expensive, but one of the sort of benefits of them is they may give you an interview, a PDF basically full of past questions. So practice as much as you can for those scenarios that have come up previously. Revise the key protocols. Revise if you're going for a surgical interview, you would probably be expected to deliver an answer according to CRISP or ATLS. And if you're going for a medical interview, especially say junior level, think about the Oxford Handbook emergency section or your ALS course, or even if you haven't done those courses, you should be able to get the manuals either from a colleague or from online, but you should be able to get PDFs of the manuals, even if you haven't done the CRISP course. There'll be a PDF of that manual around where you can just revise the key protocols, which are like chapter summaries in each one. So when you're getting a clinical question, you will get the basics of managing that scenario. But if you get through that question, then think about also a bit about team management, how you will work with your whole team to deliver what's expected of you. And if you get right to the end and you're doing really well, and then there are sort of bonus points, which are I would say mandatory as well. But if you've got time to deliver your answer in a succinct way, to really wrap it all up, you would probably, if you're in a correct hiatus in that scenario you've talked through, let's say you've sent your sick surgical patient off to the CT scanner, then that's really a good time to sort of update the family. So make sure you rehearse these, because when you rehearse these and these just roll off your tongue, then you're comfortable, you're getting through the whole scenario, and you can really sort of make sure you've given a complete answer. So then I'll talk about some sort of management scenario. So this clinical management, which is really sort of making a scenario happen, working with your team and delegating and overseeing tasks. And then there's hospital management. So hospital management, such as audits, QI, change management, doing a finance project, writing a business case. So the more junior you are, the sort of higher up that list you would expect to be. And if you're getting towards sort of consultant level, then you can think about writing business cases and starting new services. But you might get a scenario where you're asked, tell me an example of when you did an audit that changed practice. And as you're getting more senior, they might say, tell me if you've been involved in change management before. You might say that, okay, I haven't been, involved in a audit for this or that, but this is what I would do. So you can have a scenario that, although you haven't had an example yourself, you can say what you've done, and that's all about rehearsal and knowing about these systems. So make sure, from the very basics, if you're foundation year 1 levels, the sort of steps in an audit cycle. Know that you know a bit about QI projects, run charts, benefits of QI projects, managing QI projects. And as you're getting more senior, if you're going for registrar or consultant posts, how to make a change happen, how to sort of start a new service and things like that. You might have done a really good audit or a QI project or an example of these, but if your CV is, you've been making a CV for 10 years now or something like that, and you might have even forgotten one. So, and that would be a shame if you had a great example, but you just didn't remember it. So it's really also important to prepare for these questions, but almost revise your CV so you can answer questions from things that you've done. You might even have an interviewer actually pick out something from your CV and say, oh, okay, you were involved in this audit 3 years ago. Tell me a bit about it. How many patients did you have? And if you can't answer the question, then it's a missed opportunity, but it also might give the impression that maybe you've made it up, you haven't done it. So you really try and know what you've done. So they might give you a scenario, and when they give you a scenario for managing something that you've done, one of the mnemonics you can use is the STAR mnemonic. Okay, and that could be starting with situation, task, action, result. So have a look at that mnemonic, because it's a nice way to just structure any answer. So then leadership questions. So leadership scenarios, they can vary to simple to quite complex, and it might be a clinical or management scenario. And what they're really wanting to know is you've got the qualities to know how to sort out problems that really draw on leadership skills. And I've just bullet pointed a few examples here of, in an interview, what kind of scenarios you might get. So it might be that you are put in the position that nurses are not happy with the performance of junior doctors. What are you going to do? Or the trainees are complaining they're not getting enough training. What would you do? or you're on a ward round and the consultant's been rude to the nurse on a ward round, or the FY1s have been posting inappropriate content on social media, or your consultant has arrived drunk, or a colleague has arrived drunk, which is a classic one. Now, most of these scenarios, if you read your duties of a doctor on the GMC website, that, you know, most of these scenarios are pretty well covered in that. But make sure you know that document. It's free, available to everybody. So make sure you know that really well. So we'll go through this scenario, okay, in a moment. And that is that you're at the handover meeting in the morning, and your registrar has arrived, and he's done the night shift, and he has a strong smell of alcohol. So does anyone want to do this scenario? Does any of the audience want to talk me through this scenario, how they would answer it?
I think, Bhaiya, the audiences, we have to because there are so many, we can't find individual audiences to answer them. But they are welcome to have the answer that in the chat box, basically, if they want to. In terms of difficult question, one of the questions in the chat box is, what if one of the consultants, say, ask you to make changes to clinical notes, what would you do? Basically, is to how to answer difficult ethical questions during an interview. That's the question, basically.
Okay, so we can answer that also with the SPIES mnemonic. Okay, so the SPIES mnemonic starts with what is the situation. So you kind of just state what it is. It might be stating the obvious, but state what it is. This is a sort of beginning. And the most important thing is always patient safety in these scenarios. And then collecting information, escalating the problem, and offering support. So let's just say your registrar has come to the handover meeting. You've sensed that he's been drinking, possibly. You're quite worried about the patients that he's looked after overnight. So you're going to just probably keep him there. You're going to tell him that, look, hold on for a few minutes, stay here for a moment, don't go anywhere. I'm going to be back. And you need to go and speak to another colleague, a senior colleague, the sister in charge of the ward, and just let them know that, look, I just want you to check up on the patients that were reviewed overnight. Or it's difficult to, before you have enough information to particularly name your colleague or whatever, but you need to find a way demonstrating that you care about patient safety, and you want to know that the patients that your colleague has seen overnight are safe. Okay, so it might be somebody has to just go and review them and see them, and then you're going to go back to your colleague and you're going to have a chat and say, look, I'm, you know, Mr. or Miss so-and-so, I'm really sorry to bring this up. I'm a little bit worried because I can have got a strong smell of alcohol. Is everything okay? And you're going to give a chance to explain what's happened, okay? Because your role isn't to judge them or scold them or punish them. Your role really is colleague, and although your patients come first, your colleagues' well-being also matters, and you want to know what's happened. And they might completely deny it, or they might say, look, you know, I'm going under a lot of stress with my divorce, or with my, you know, with my annual review or appraisal, and it's led me to drinking. And once you've got the information and you found out what's happened, as a leader, you know, empathy comes hand in hand with good leadership skills. You're going to be empathetic with your colleague. You're going to say to them, I'm really sorry to hear that. You're going to say, look, is there anything you need a hand with? If you've got too much work burden, is there anything I can help you with? And then you're going to say to them that this is a serious matter. This is not something that we can just say that, okay, let's just hope it doesn't happen again, because this is of a level that needs escalating. And so that means that you may have to either inform the head of service or the clinical governance lead, but this is a serious matter, so it needs escalation. And well, I've already mentioned this, but the last bit of SPIES is support. So really making sure that they're okay, that you know, they're going to be safe to go home. And I personally would, in these scenarios, say that, look, I would also call them a taxi so they're not driving home drunk. And you've got to be as supportive as possible, because when you've got these difficult scenarios, you've got two factors. It's the patients have to be safe, but also your colleagues. You are their support network in some ways, and you've got to support them as much as possible. So if you use that mnemonic for the question in the chat box, let's say you've been asked to do something that you think is unethical, then what you've got to really look at is, okay, is there a patient safety issue at the moment? So you've got to say, look, patient safety is the paramount thing. So I'm going to make sure there's no patient safety issue here. Notes haven't been changed or altered, or there hasn't been a clinical problem and notes have been changed. I'm going to obviously explain to my colleague that this is not possible, unless obviously, this is a misunderstanding and they've asked you to actually, in retrospect, write something that happened. So you probably seek some more information and speak to your colleague and say, look, I'm worried that, what you're asking me to do is changing notes. So can you just explain things a bit more, and if they say that actually, no, look, there was an error in the recording and I want you to cross out, but clearly so it's legible, what was written before, and state on there this is written in retrospect because the last report was in error. So you've got to find out and get some information. But if your consultant is actually telling you, no, I want you to, alter something and almost erase something else, and you think that this is an ethical problem, then this needs to be escalated. So you need to have a reasonable idea of what your channels of escalation are. So, your options are head of service, clinical director. There's going to be a clinical governance person in your department, and there'll be somebody who's in charge of the division, like a divisional lead or head of division, be a medical director. So you have to have a rough idea of your line of escalation and who you go to. If you're a trainee, you may also have an educational supervisor who needs to know about these things. So you would want to escalate that to them. And then you'd probably want to make sure that your colleague is okay as well, believe it or not. So you probably want to say to them, look, I'm really sorry I've had to escalate this, okay, because this is a serious problem, and I'm sorry I've had to do that. And they might say to you that, oh no, look, I'm under a lot of pressure with a lot of complications and stuff like that, and this has happened and this has happened, and I'm getting sued by 2 other patients, and I just couldn't afford for anything else to happen, and that's why I got to do it. So you've got to be empathetic again. So look, I'm really sorry this is happening. If there's anything I can help with your workload or something, let me know. I'm sorry I've had to escalate, but I had to. But make sure you get that support thing in there as well. So that was a leadership scenario. So a bit more about what I said before about knowing yourself. So when you're giving examples, a lot of the questions will say, tell me a time when you did this, or tell me a time this happened. And you might have actually done something along those lines, but go through your CV and almost think about those contents in your CV being turned into questions. So for example, as I said earlier, like somebody asks you about an audit you've done, if you've done scores and scores with them, then make sure you just read through them and you remember what happened. Or there might be one that you only did the first cycle and that was 3 years ago. Go and find out if actually another SHO or registrar completed that cycle and it's been completed, because you want to show that you're sort of a finisher. So even if you didn't finish an audit yourself, if somebody else has, then that's a completed cycle, and that's fine. These kind of things usually have to get handed over. It's hard to complete an audit cycle in a job or a rotation. Then look at your strengths also in your CV. So if you've done anything that stands out, just have a think about it. Have a think about what it really means, because you might have delivered a surgical skills course, for example, and that might have called upon leadership skills, teamwork skills, negotiating, for a venue without charge. There might have been a lot of things that have come out of it, and there may be so many aspects that you can sell yourself in from those examples. And one example might lead to many selling points. So have a look and don't have, I understand that we all have imposter syndrome, but don't be overly modest. Think about something that you felt was a good achievement on your CV, and think about how you can really sell yourself in an interview with that, because it might be something along the lines of the question might be, what was your proudest achievement? Okay, and so that's similar, but not exactly, tell me about some of your strengths, but it is your proud of achievement may be one of your strengths. So a lot of same questions can be asked in different ways. So know your examples in your CV really well and in depth so you can sell yourself. The other thing is also your weaknesses. So you might actually get asked, tell me about one of your weaknesses. And obviously don't give an answer that's absolutely damning, and that will mean that nobody will want to hire you. So a good example would be something that was in the past a weakness, but you've worked on to get better. So for example, this is a real life example. I got asked about my weaknesses in an interview, and I told them that my publication to presentation ratio I was not happy with. I had far more presentations than publications, which looked to me like I was not following on and writing up projects as publications. And there were reasons behind that, because a lot of my presentations are projects that I've given to juniors to really help them out with their CVs. And they've normally been the kind of project that's good enough to get you presentation points to go for a job interview, but probably not substantial enough for a paper. But nonetheless, I see how it looks on my CV. You know, 3-4 times more presentations than publications. And what I'm doing now is being selective about the projects I'm getting involved with that I think are actually more publishable. And you know, that's a real life honest answer. But there may be things like that on your CV that you can it's not completely a weakness because you're working on it. So have a look through your CV and pick some of those out, and that process itself might genuinely show you something that you want to work on from your CV. So then the last thing, the interview, you have to prepare and know your job. Ask yourself about the job description and the person's spec. I think, who do they want to hire? And then know yourself and prepare for your interview as much as possible. So the other thing to do is interview courses. So there will be interview courses for training posts, and there'll be interview courses for even ST, SHO level posts. One website that I know quite well, IST Medical. I've been on their consultant interview course before, but they have got interview courses for SHO level posts as well. And that's